Confidentiality is the principle that patients have a right to have their medical records kept private. Now, this includes interactions with doctors and all other members of the healthcare team. The reason this is important is that it's one of the fundamental aspects of how patients interact with healthcare providers. They need to know that they can trust their healthcare providers and that the information that they share with them, which can often be quite sensitive and personal, isn't going to go anywhere else. The General Medical Council, or GMC, have very good guidance on when confidentiality can be broken if necessary. There are some circumstances where sharing a patient's confidential information without their consent is necessary, such as if they are likely to harm someone else through their actions and the medical professional has a strong suspicion that someone else is going to come to harm from that. If it is in the public good, so there are some infectious diseases where it is necessary to tell Public Health England about that infection being there, and that can be done without patient confidentiality because it's in the public good. And lastly, if the patient doesn't have capacity to consent to their information being shared, but it's in their best interests. You might get a situation where a patient is informing their doctor that they are, for example, going to go and harm someone else through their actions. So what you need to do if you are asked that question and what you do in that situation is you need to clarify what is going to happen to the person that might get harmed. You want to get as much information as you can. And if confidentiality is going to be broken, then the doctor needs to tell the patient that that is what they're going to do. They need to be upfront with them and tell them about that.